It's a pleasure to have you join us on another episode of 360 Health. I am Ogechukwu Okekwe. In a significant step towards improving the country's blood banking system, the federal government of Nigeria has initiated efforts to establish a unified national blood database. This move was announced by Director General of the National Blood Service Commission, Seliu Yuguda, during a collaborative meeting with a team from the African Medical Center for Excellence in Abuja. The African Medical Center for Excellence, a private specialist hospital currently under construction in Nigeria, is set to specialize in oncology, cardiovascular health, and hematology. The hospital's team is seeking to collaborate with the National Blood Service Commission to identify areas of beneficial partnership. The Federal Ministry of Health and Social Welfare, the Federal Capital Territory Administration, the Clinton Healthcare Initiative, the Medical Cancer Foundation, and other stakeholders have pledged to drive a sustainable grassroots campaign in cancer control and care. They pledged in Abuja at the inauguration of the 25-member City Executive Council for the City Cancer Challenge Initiative in Nigeria. The CISCAN has been a force in global effort to ensure equitable and high-quality cancer care since its inception as a union for the International Cancer Control Initiative in 2017. The Ondo State has, through the Ondo State Primary Healthcare Development Agency, announced the launch of vaccine into routine immunization. The agency said this on her official Facebook page while stressing that the initiative aims to protect girls from cervical cancer and other HPV-related diseases. It further informed the public that vaccination sites are all PHCs across the state as well as designated outreach sites in schools and community centers. We'll go on a short break, but when we return, we'll be joined by our guests to speak on obstetric fistula. Don't go away. Welcome back. Obstetric fistula is a severe medical condition that primarily affects women in developing countries. It is a childbirth injury characterized by an abnormal opening between the vagina and the bladder or between the vagina and the rectum. This condition leads to continuous and uncontrollable leakage of urine and feces through the vagina. However, the primary causes of obstetric fistula is prolonged obstructed labor without timely medical intervention, typically due to lack of access to quality medical health care. Well, joining me on the program to discuss further is public health physician Dr. Oluwayemisi Adegboye. Thank you for joining me on the program, ma. So can you tell us more about obstetric fistula and how it occurs?
Obstetric fistula is a terminology that has two words. The first is obstetric and the second is fistula. Obstetric has to do with something that occurs within the female genital tract, while the fistula means a hole. So when you say obstetric fistula, it means that a hole in the female genital tract that is linking with either the bladder or the rectum or both. And when we talk about obstetric fistula anywhere in the world, it is a serious and tragic, and in fact, is a devastating problem that can ever have happened to a woman during childbirth. And then the causes is just one thing. Usually when the woman has gone through prolonged and obstructed labor, meaning that once a woman goes through a prolonged and obstructed labor, the head of the fetus kind of stays or sits on some vessels and nerves, thereby reducing blood supply to such area. And then we say it causes something we call ischemia, and then makes that area dead. Once that area is dead, then it means that blood supply is cut off, and then it begins to die or decay. That's what results into that hole that connects the birth canal to either the bladder or the rectum. And whenever this occurs, it results in something we call incontinence, whereby the woman will begin to either leak feces or urine or both. It's a serious problem, and I hope someday we won't need to have such again, ever.
So what would you say are the signs and symptoms of obstetric fistula, and how can it be treated?
Thank you. You see, when we talk about signs and symptoms, like I said earlier, one of the famous or most prominent signs and symptoms you can see is the incontinence, whereby there is leakage of stool or feces. So once that is there, it occurs or it causes other things, like wherever the urine is, since it's touching the skin, it can cause dermatological problems, whereby there will be skin rashes and other infections around the laps of the woman. Then it can cause fever. It can also cause kidney problems. Then it can also cause infertility in some women. So these are some of the signs and symptoms that someone begins to see. There is pain. Some people will have serious suprapubic pain or pain around the genital area.
So what are the treatment options of obstetric fistula?
So when you talk about treatment, I would like to say that obstetric fistula is highly preventable. It means that in the first place, it's possible that it does not even occur.
Okay.
But if it occurs, one of the major things that can be done is surgery. Surgery, the one will have to go through surgical procedure to fix that hole, to repair that hole, so that there is no connection or link between the genital tract of the woman, the reproductive, the birth canal of the woman, the bladder, and the rectum, or the three. So that must be blocked and then repaired. Then other things that can be done is that apart from the medical treatment or the surgical treatment, there are also other treatments called rehabilitation treatment, whereby because some of the women would have been isolated because of this problem. And so part of the treatment is to rehabilitate them and bring them back into the community. So that's another treatment. Then other treatments will also have to go along the medical line. So I've talked about the surgical line, then the rehabilitative line. Then we also talk about some other medical line, whereby if the woman has rashes, you treat the rashes. If the woman has fever, you treat the fever. If the woman has cystitis or pyelonephritis, you treat with drugs. If the woman has pain, you treat. So those are the other major treatments that I can give women. So the treatment can be surgical, medical, and rehabilitative. That is a psychological treatment for that woman.
So what are the physical and psychological impacts of obstetric fistula on affected women?
Oh, well, it's enormous. And like I said, whenever we see anything like obstetric fistula, it's just an attention call to everyone to let us know that we still have serious inequality problems in the country or wherever it occurs, even though it occurs globally, but it's more among the low and middle income countries and the low income countries, and Nigeria inclusive. And so the impact is as physical, social, it has psychological, it has spiritual, it has all impacts, cultural impacts. Talk of all the even economic impacts. It has impact in diverse ways. So one of the physical impacts is that the woman has like the skin rash that I told you. Some of them on their physical body, maybe even after repair, they can have problems with having sex because of maybe stricture in the vagina area. They can have issues with childbearing because some of them probably must have maybe ruptured the uterus at a point in time. So it can cause problem with childbearing. Then when you talk about the psychological effect, it causes separation, stigmatization, isolation. People are separated from the community. And then with that, a woman who is isolated, you can imagine what will happen to such woman. Yeah. So the woman will stigmatized with like smelling because they have to go around with physics, remember physics or urine leakage. You can imagine that. So it's a serious problem on their psychology. It can even lead to depression and suicide in some cases. Yeah. And then when you talk about the social impact also, in our environment, when a woman can no longer give birth as a result of this, it can result in divorce. It can result in in the woman being left out of the community or the society. In fact, an interesting thing we need to know and we need to stop is that the cultural effect of such is that some people still think any woman who has that is a punishment from God, or punishment for one of our sins, or even punishment for infidelity. And so some people see it as punishment, which is something that needs to really need to join hands together and work towards to ensure that we bring a stop to this cultural mix and misconception. And when you talk about this, all of this will also lead to poor economic impact, because the woman will not be able to work, and so she will not be able to have enough money to take care of herself. And then the cycle goes round and round like that. So these are some of the impacts that obstetric fistula brings to the way of any woman who has it.
What would you say are the main barriers to preventing and treating obstetric fistula in developing countries?
Wow, we have many barriers, we have many challenges. And one of the challenges I will talk about, or barriers, is I will grade it from the individual to the family or the community to the health system and then the nation at large. So for the individual, one of the barrier or challenges we can talk about is that when a woman is uneducated and not empowered, it's a problem. When she does not know what to do with her pregnancy or during her childbirth, she's not educated, she does not have the capacity to diversify if, oh, I need to get out of this place now, I need to get more help now. So it's a problem when the individual has that. In fact, also if an individual is malnourished, it's been found that there's a link between a woman who is malnourished and having obstetric fistula. Then when you talk to the family and the community, when they have poor economic status, or maybe the father of the house is not empowered, and then this cultural boils down to this community whereby they say the woman can't go out, you can't give birth out of the house and all of that. So once the woman, even if she has prolonged labor, they may feel they should pray or do one or two things, or say, oh, no woman has ever given birth out of this compound. All children must be given birth within this compound, within this village, within this community. Is it taboo to have a CS? All those things. It is a problem. It is a barrier that can affect, that can cause or aggravate the incidence and prevalence of obstetric fistula. In the health system also, there's another problem we usually face, whereby the health system, the government, sorry. In the health system, there's another problem that is common, whereby the health workers have little or no knowledge of what to do when there is a prolonged labor. And also another thing is when there's poor road network, even when there is obstruction, you wonder, how do we get this woman from point A to point B without delay on the road and all of that? So it's another major problem for the health system. Also, when we have health workers who are poorly trained and cannot recognize where danger signs when a woman is in labor. Another thing also is brain drain. We have many facilities whereby we have few health workers working there. So before you attend to this, attend to that, attend to this another person, you have a situation whereby either doctors or the nurses, maybe they are fatigued or they are burnt out. They will not be able to adequately attend to patients or to women who are in labor. So brain drain in the health system is another serious factor. Also, when there are poor equipment, if a woman needs to do CS and then there's no equipment to do CS, even if we have the human resource, is another problem. So we have barriers and problems from the individual to the family, linked to the community, and then the health system. So all of these, there are barriers at different levels. And another barrier that I mentioned also is the nation at large, whereby we have poor road networks, poor transportation system. In some places, it's just Okada that you can find a motorcycle. In some places, it's just keke napep. So how do you want to put a pregnant woman on Okada? So these are some of the problems we have. Ignorance is another problem. So the health, one of the work of health system or the primary healthcare centers is to educate people. Even if you have traditional birth attendants in your community, we know that we cannot completely erase cultural factors. Yeah, we cannot completely erase cultural factors, but it's the duty of the health system, especially the primary healthcare, if they're equipped, to go out there and educate the traditional birth attendants so that they'll teach them how to recognize the signs. So when there is any aid, they know who to run to or who to call. So that is another fun, because one of the major functions of health is health education, increase capacity of people, and train. So when all of these are lacking, we will continue to have this problem. So that's it. Thank you.
So what are the challenges in raising awareness about obstetric fistula globally?
Yeah, the challenge major is behavioral change. That's the major challenge I see. Sometimes, or some people, they will not easily just want to change the way they think, especially when you talk about age-long methodology of doing things. It's not easy to just come and tell them something. They'll tell you, this is how our forefathers have been doing it. And this is what we do in our own community or in our own compound. It's a taboo to do this. They can even tell you, you go to the hospital, it means you are not a strong woman. Do you understand? So we have some myths and misconceptions about this. And until we have behavioral change, there's really nothing we can do until behavioral change happens. And then we have to continue to do information, to give education, and to communicate to people. It's not something that will happen overnight. And it's not something that will be done one-off. So it has to be continuous and consistent. So with commitment, we can actually end obstetric fistula globally. It's possible. So once people are knowledgeable about it and they have the power to know what to do, because knowledge actually is power. So when people know what to do, they're empowered to do the right thing. So these are some of the things we need to do continuously. And that's part of what you're doing at TV 360. And I don't say kudos to you. This is part of what you're doing, educate people, tell people what to do, what not to do, and letting them to be aware of this condition, and so that they also do not fall or be part of the numbers.
How can improved access to maternal health care help prevent obstetric fistula?
So in all of this, that is the icing of the cake, or that is the summary. This is highly preventable and can only be prevented if our health system is top-notch, and if our health system is correct, if our health system can get it right and ensure that this, I don't know if I can call this on television, this evil can be stopped, actually. Because remember, from the definition, it says is a serious, is a tragic, is a devastating. It also speaks to enormous gap in the equality or inequality that's happening in our environment. So it's to tell us that there is a serious gap somewhere. So to me, it is a social injustice if the health system is not equipped enough to curb obstetric fistula. It's social injustice to me. Yeah, that's the way I see it. So we need to begin to see what we need to do to ensure that this is stopped. And it can. One today, two tomorrow, we can. So once the health systems are empowered to do this, once the health system is empowered to do this across the country, starting from the community to the ward level, to the local government level, to the state level or the regional level, then we win. It's a fight that we need to continue. It's a battle that we need to fight. So health system, when you talk about health system, it's not just talking about the drugs. It's not just talking about the injections. It has to do with a lot of things, from the policy to the leadership, to the drugs, to the financing. All of that together form the health system. From when you talk about the health system, it's not just about people working. It's not just about the injections you give or the drugs. It's beyond that. It's also about the policy. It's also about the leadership and management. It's also about the financing, the human resource, the drugs, the investigations, all put together that forms the health system. So all of this must be aligned to ensure that the stop obstetric fistula, if they are aligned, a hospital will know that in this hospital, this is what we need to do. This is what we need to put in place. So when a woman is in trouble, you know what to do because something has been put in place and because the system is working. So if there is problem with the leadership, it just streams down. If there is problem with the human resource, it streams down. If there is problem with the financing, the same. So all must work together in alignment to ensure that we put an end to obstetric fistula. Training, like we cannot stop training health workers. They must continue to be trained so that they will identify danger signs in time and they should know what to do. Yeah. There must be collaboration. There must be partnership. We can't say that all hospitals should be able to do CS, but you can collaborate and say, okay, when we have a problem here, what's the next nearest secondary facility that we can call? Who is the nearest next doctor that we can call? What's the nearest help we can get? So all of that put together will make give us a fantastic result.
So what can individuals like you and I do to help in the fight against obstetric fistula?
So at individual level, there's something we can do. You know, some people will say that if I'm not at the leadership position, I don't have power. I don't have anything to do. I can't do anything. I don't have mouth. You know, something I don't have mouth. No, we all can do something. I can do something. You can do something. We all can do something. So the win starts from us that knows this thing. It's just to keep on educating women around us. We all have them. We know people that ordinarily maybe they're just talking and they're talking about their community, traditional birth attendants and all of that. You know a pregnant woman around you. You can talk to that pregnant woman and say, no. If you're experienced, you can talk to a woman and say, once you fall in labor, which hospital are you using? Once you fall in labor, they have this in the hospital. Once you fall into labor and it's this and this and that, you know, these are things you can do. These are things you should not do. This is where you should seek help. Do you understand what I'm trying to say? And then begin to educate, especially for the spiritual aspect. Some people feel that it's a taboo for them to go through CS. Yeah. In this 21st century, there are some people like that. So you need to educate them and let them know that it is not a taboo. God created science for our use to save us. Just like you have headache, you use paracetamol.
Yeah.
Just like you have malaria, you use anti-malaria. So it's the same when you have obstructed labor or problem with the pregnancy, you do CS. It's the same. Absolutely the same. So we just need to educate people around us. You don't have to, I don't have to carry a megaphone and be running around and say, oh, this and that. I know one or two pregnant women around me. I can talk to them about it. When you're equipped in your community, you can talk about it. In your church, in your mosque, you can talk about it. Anywhere you go, you can talk about it. You understand what I'm trying to say? When you have community outreach, you can talk about it.
Yeah.
On the radio, on the television like we're doing now, you can talk about it.
Well, public health physician, Dr. Oluwayemisi Adegboye, many thanks for lending your thoughts on the program. And that's it on this episode of the program. Many thanks for watching. See you next time.